Hi, I'm Dr. Bill Page, and I want to welcome you to St. Joseph Mercy Chelsea, a community hospital nestled in a beautiful setting where you will be surrounded by state-of-the-art technology, compassionate care, and a renovated facility. Your surgical experience is extremely important to us. Our skilled team of surgeons, anesthesiologists, nurses, and healthcare professionals all want you to have a positive experience here, and we'll do our best to make your experience as comfortable and stress-free as possible. In this video, we hope to answer many questions you may have about your procedure, but if you have any questions along the way, please speak with your doctor, nurse, or any of our team members. We are here for you. Thank you for choosing St. Joseph Mercy Chelsea.
As your surgery date approaches, there are several things you can do to prepare for your operation. By taking these few steps, you'll help promote a successful surgical outcome and speedy recovery. Physical activity will improve your blood flow and circulation, both essential during surgery and recovery. Eating a well-balanced diet and following a good nutrition plan will help promote natural wound healing. It's best to stop smoking 6 weeks before surgery, and you should not smoke the day of surgery. Within 48 hours before your planned surgery, the pre-op nurse from our department will call you with important information. During this phone call, you'll be asked to verify your current medication and allergies. You'll also be asked about your medical and surgical history. Having your medication bottles in front of you during this call may be helpful. We'll confirm your surgery date and arrival time and tell you which of your home medications to take or avoid on the day of surgery. You'll be instructed during your pre-op phone call as to what time you'll need to stop eating and drinking. Generally, you'll be allowed to eat up until 8 hours before your procedure, and you'll be encouraged to drink only clear liquids up until 4 hours before your procedure. Do not chew gum, hard candy, or chewing tobacco, and do not smoke cigarettes after midnight before your surgery. Please follow carefully the eating and drinking instructions given to you during this call, as they may vary from what's presented here. Be sure to use any special antibacterial wipes your surgeon may have given you, and follow the accompanying instructions closely. You'll need a responsible adult companion to accompany you the day of your surgery and to drive you home. Because of the lingering effects of anesthesia, you'll not be able to drive 24 hours after leaving the hospital. It's also a good idea to confirm your arrangements with your companion the day before. On the day of your scheduled surgery, here are important things to remember. If you have used the bacterial wipes, do not shower, bathe, or shampoo your hair in the morning, unless of course your surgeon has instructed you otherwise. All other patients should shower or bathe using an unscented or non-perfumed soap or body wash and shampoo their hair. Do not put on any lotion, perfume, cologne, deodorant, and do not wear any makeup. Wear loose-fitting clothing. You may brush your teeth and gargle with mouthwash, but remember, do not eat anything, including breath mints, and do not chew any gum. Take only the medications you've been instructed to take, and take them only with a sip of water. You'll need your picture ID and your insurance card, but leave valuables like jewelry, including wedding rings and all body piercings, purse, wallet, cash, and credit cards at home. Bring your glasses and hearing aids along with a case for them. Leave your contacts at home. If you must wear your contacts, bring your storage container. You'll be asked to remove them prior to surgery. You'll be asked to remove any dentures or removable dental work, body piercings, wigs, hairpins, hair clips, or wedding rings prior to surgery, so you may want to leave those at home as well. Do bring crutches, your walker, or your cane if you have an assisted device for walking. If you're being admitted after surgery, you're welcome to bring the following items: pajamas, robe and slippers, although hospital pajamas and gowns are available. Comfortable walking shoes if needed for walking after surgery. Personal toiletries, and your CPAP machine if you use one for sleep apnea. As a courtesy, we will check your machine to ensure proper functioning. You and your responsible companion should arrive at the surgery center located in the rear of the main hospital at your appointed time, which will be 1 or 2 hours prior to your surgery. Once on the St. Joseph Mercy Chelsea campus, follow the signs directing you to the surgery entrance. If you require a wheelchair, there will be one waiting by the entrance. When entering the surgery department, check in with a waiting room coordinator. They'll take your information, direct you to registration room 1 or 2, and facilitate the registration process. Once you've completed registration, you'll be directed to return to the waiting room. In the surgical waiting area, the waiting room personnel will give you a brief orientation and introduce you and your companion to the Surgical Services Tracking Board. The tracking board allows your companion to follow your progress through pre-op, surgery, and recovery. Each patient is assigned a tracking number, and only that number will appear on the screens to ensure confidentiality. Your companion should leave a mobile number with the receptionist. When your name is called, you'll be escorted to the pre-operative unit by a member of your surgical team. Companions will need to wait for the first part of pre-operative care, which typically takes 40 to 45 minutes. Once you're in the pre-operative room, also known as pre-op, your height and weight will be verified. You'll be asked to use the restroom and change into a surgical hat and gown. You'll be given a bag for your personal belongings. Your vitals will be taken. For your safety, it is our routine procedure to verify your information several times before your surgery. Questions may include: what is your name and birth date? What kind of surgery are you having? And on what part of your body is the operation? Please take time to review the consent forms and confirm that the surgeon and procedure are accurately stated. While in pre-op, a nurse may shave the surgical site and start an IV. You may also have sequential compression devices, SCDs, applied to your legs, either in pre-op or in the operating room. These are stocking-like sleeves that'll squeeze and massage your legs during surgery to promote blood flow and help prevent blood clots. Also in pre-op, you'll meet the anesthesiologist, who will ensure that you are safe and comfortable in surgery. They'll review your health history and explain the best options for anesthesia during your procedure. After they've answered all of your questions, they'll have you sign an anesthesia consent as well. Your surgeon will stop in to talk to you and answer any last-minute questions. Your surgical site may be marked at this time. Once you have had your initial meetings with the surgical team and received any necessary medications, up to 2 companions will be allowed to stay by your side until the anesthesiologist begins any necessary procedures or until you are wheeled into your surgical suite. By then, you will have learned the approximate length of your surgery, so your companion will be able to plan for his or her wait time appropriately. Most patients' last memory is leaving the pre-op unit and then waking up in the recovery room with their surgery completed. During your surgery, companions will be able to receive updates about you on the patient tracking board. While waiting, companions are welcome to use the beverage and snack station in the waiting area or visit the hospital cafe, gift shop, Joe's Java, chapel, or in-spirit salon. Your companion should carry a cell phone when traveling outside the waiting area inside the hospital buildings in order to be reached with any updates. It's also helpful if your companion informs the receptionist upon leaving the waiting room. At the end of your surgery, your companion will meet with the surgeon in a private consultation room to discuss the surgery findings and expectations for recovery. You will go to the recovery room. When you're in the recovery room, your nurse will monitor you continuously and give you IV medication to help ease the pain and ensure your comfort. Following anesthesia, it's not unusual to experience chills or for sounds to seem louder. It is also common for time to go by quickly. You will be medicated for pain, and your nurse will make sure that you are comfortable. Your nurse will also encourage you to take deep breaths and cough. One companion will be allowed to sit by your bedside in the recovery room. You'll be offered a beverage and possibly food. Most patients usually stay in the recovery room for 1 hour. The longer recovery may be needed and is not unusual. If you're being admitted, you will move from recovery to your room. If you're leaving on the same day of surgery, Your anesthesiologist and your recovery room nurse will determine when you are ready for your discharge home. When you're awake, your nurse will review your discharge instructions with you and your companion. Most surgical patients that are admitted are taken to the atrium wing. Your room at St. Joe is private and has been designed with the comfort and convenience of you and your family in mind. Once you get to your room, you'll meet the nurse who'll be caring for you. The nurse will ensure that you're comfortable. You may be asked several questions about how you feel to assess your pain level. You may still have your sequential compression devices on your legs to promote circulation. You'll also learn a few tasks that you should perform in order to aid your healing. You'll be taught to cough and breathe deeply. This will help clear your lungs and decrease your chances of getting pneumonia. If your surgery was abdominal, you'll be taught to use a pillow to splint your incision while you cough or breathe deeply. This will decrease pain at your incision site. You'll also be taught to use an instrument called an incentive spirometer. This is a device which helps you inhale deeply to expand your lungs. It will also decrease your chances of getting pneumonia. You'll be encouraged to get out of bed, preferably on the same day as surgery. Simply taking a walk down the hall will help your blood circulation. Our patient care associates will be available to assist you. You will likely be given a blood thinner medication during your hospital stay. This will either be a pill or an injection, depending on your doctor's order. This medication is important to prevent you from getting a blood clot in your legs or lungs. To get to the patient rooms on the second floor, your companions that wish to visit during your stay should use the main elevator at the atrium entrance. If your companion would like to rest or sleep while visiting, the sofa in the room converts to a bed. When your medical team feels that you're well enough to return home, you will be discharged. Your companion will participate in reviewing your discharge instructions and any prescriptions. A written copy will be provided and any questions will be answered. Before you leave the hospital, your doctor and nurse will teach you some very important tasks to complete as you continue to heal at home. Most patients, due to anesthesia, won't remember speaking with the surgical staff during recovery. It is important that your companion relays your discharge information to you once you're alert at home. Your nurse will review your medications that you'll be taking at home. You'll be instructed on diet, activity level, bathing, and wound care. Finally, you'll be given information on a follow-up visit with your surgeon, usually within a week of surgery. When you're ready to go home, your companion can drive to the patient pickup entrance, and a patient care assistant will escort you to your waiting car. Remember, you will not be able to drive home.
Thank you for watching this surgical experience video. We sincerely hope you found it helpful. If you have any further questions or concerns, please call the main number at the hospital and your call will be directed appropriately. Thank you for choosing St. Joseph Mercy Chelsea and entrusting us to perform your surgical procedure. We take your decision very seriously and believe it a privilege to care for you. We are confident that you will receive the very best, comprehensive, and compassionate care during your stay.